Now, this week on Africa News Tonight, there's a special series looking at HIV/AIDS in South Africa. My colleague Bill Eagle is here to tell us all about it. Bill, of course, this will be a radio series, and why South Africa in particular?
Ndimyake, there are over 5 million South Africans infected with HIV/AIDS, one of the highest rates in the world. And now the new administration of President Jacob Zuma has an ambitious program to deal with the problem. It's committed to getting antiretroviral drugs to at least 80% of those who need them. Most of the medicine is distributed by a number of state hospitals for free. But there's also word of shortages and of rationing in these hospitals. So Johannesburg-based reporter Darren Taylor went to one of the country's poorest provinces, the Free State, to find out for himself.
So what did he find out from Free State?
Ndimyake, nurses tell him that they do indeed ration the pills because of shortages or a fear of shortages. They're also supposed to instruct patients how to take the pills. The problem is that many nurses are not trained to do this, and there's a chance of misinformation.
And Darren did manage to speak to some officials, at least specifically a health official there in Free State?
Yes, he spoke to the provincial health minister for Free State, Cici Mabe. She said in July that she had $31 million to buy more drugs and denies there's any shortages, but activists say there are shortages and that the money has been wasted in part on lavish social events thrown by the Ministry of Health. She denies those charges.
Well, thank you so much. I guess our listeners will have to tune in to the radio to hear the rest of that report. That's Bill Eagle here at VOA.